Hey everyone, I'm Steve with Optimal Function Physical Therapy and Wellness, and Dean is my demo guy.
Hey guys.
We're going to be putting out tips on a Tuesday, so we're going to call it 2-Tip Tuesday. Okay? So we're going to go over the first 2-Tip Tuesday is bracing. So often in the gym we'll walk around and say, hey, get tight, or are you braced, and a lot of people may not know what that means right away. So we're going to go over and give an explanation and a demonstration of what that is. Okay, so I'm going to have my demo guy lay on his back. Okay, and what we're trying to do is organize our spine in alignment so our spine is braced and our core is braced for a lift, like a deadlift, a squat, a push press. So we always say get tight or get braced. So the first part about that is putting our system on alert. So what we're going to do is we're going to have Dean point his toes, okay? And that's all we're going to do for right now. So what that's doing is that's putting your posterior chain on alert for a lift or to get organized. Okay? The next part of that is going to be to squeeze the glutes. Okay? So you notice how Dean, when he squeezed his glutes, so unsqueeze, squeeze. Notice how his pelvis tilted. So it took his pelvis and it tilted into neutral alignment. Okay, so relax. Good, so point your toes, squeeze the glutes. So now his spine is in alignment with his pelvis or his core. So we go from thoracic to lumbar to pelvis. That's all in alignment now just with that one glute squeeze. So we often see patients with low back pain or something like that, and this is the first thing we do is have them point their toes, squeeze their glutes, and just get into neutral alignment. And sometimes that's all it takes is alleviate some pain. So if you're having some minor aches and pains or something like that from your low back, this might be a quick fix for that. And this can be an exercise all on its own. It's just squeezing that glute and getting that pelvic tilt and that pelvic and lumbar to align. Okay? But after that, moving on up the chain, so we went toes to glutes. Now we're going to talk about diaphragmatic breathing. Okay, so you can unclench and don't worry about pointing your toes and glutes right now. So what we're going to do is Dean's going to put one hand on his stomach and one hand on his chest. Okay, so right now I just want Dean to worry about raising this hand up, leaving this hand where it is and raising this one up. So just breathe through your diaphragm. Okay, so he does a good job of breathing through his diaphragm. You can see that hand raise and lower with his diaphragm. Good, so I'm going to take him one more breath. And then on his breathe out, I'm going to have him get tight like I'm punching him in the stomach. So breathe one more time, all the way up, and then all the way out, and then get tight. So what he's doing is he's drawing his belly button and his spine together to organize that. So oftentimes we see, you can unclench, you can breathe. So oftentimes we see like Olympic lifters or somebody that's an experienced lifter, they have what we call a fat belly syndrome, where we've talked about getting a fat belly. And what that fat belly does is you put air in your stomach, so you get that fat belly. So what that does is that puts air around your spine. Okay, so it lets that spine wiggle as you're moving. What we're trying to do is get all that air out of the spine to get stability around the spine, so your muscles control your spinal, not the air compression around it. Right, so we want that spine to be as stable as possible. That's why we're taking all the breath, or all that air out around your spine. Okay? So now we're going to put those three things together. Okay, so Dean's going to point his toes, squeeze his glute, get into alignment, big breath from the diaphragm, breathe out, get tight. So ribs lower, and now he's tight. Like I can punch him, right? Like you're bracing yourself for a punch. Okay, so this would be your bracing sequence. Laying down, obviously, but now it translates to a stand-up position. So that's going to be our next method. Okay, so once again, toes, glutes, diaphragm. Okay, so it's going to be our same sequence now when we stand up to do a lift. Okay, so Dean's going to stand up. Okay, so now proper sequencing, so you're going to face the camera. Okay, so what Dean's going to do is we're going to work that same method. So back up a little bit. There we go. Okay, so we're going to work that same method. Only instead of pointing the toes, I'm going to have Dean create torque, right? So what he's going to do is if his toes are straight, I'm going to have him rotate from the hips and turn his knees out like he's going to squat, right? So think here and rotate the knees out. Yep, still in a stable position, right? So creating a little bit of torque. Yep, just stand, create a little bit of torque. Yep, just turn the knees out, squeeze the glutes, diaphragm breathing. So breathe out, breathe in, and then get tight. Yep, perfect. So just like a boxer would do, bracing for a punch in the gut, now he's tight, his muscles are turned on, and he's ready for a lift. So this would be our proper sequence for a deadlift, push press, back squat, any lift that you could imagine, hang clean, power clean, anything like that, we're going to be turned on before we grab a barbell. So that would be our proper bracing or a get tight sequence.